Welcome to Focus on Abilities, a program about issues affecting the lives of people with disabilities. I'm Lex Frieden. I'll be your host for today's program. I'm professor at the University of Texas Health Science Center at Houston, and I direct the Independent Living Research Utilization Program here at TIRR Memorial Hermann. We have a very special show for you, one that you're not going to want to miss today, so please stay tuned. We're at Focus on Abilities. I'm Lex Frieden, and we have a special guest with us on Focus on Abilities. It's Lourdes Cuéllar. Lourdes, thank you so much for being on our show today.
It's a pleasure. I'm delighted to be here with you today.
Now, you have been described as an educator, a mentor, a scholar, a scientist, a pharmacist, a teacher, and most recently, a retiree.
Absolutely. Ask me which is my favorite one.
Seriously, how would you define yourself?
Very much as you've described me. I love to teach and have been associated with the University of Houston College of Pharmacy for many years, also with Texas Southern University and the University of Incarnate Word in San Antonio. And I've served both locally at the state level and national level in leadership positions for my profession of pharmacy. I believe one of my greatest loves, though, has actually been teaching and mentoring the next generation of practitioners as pharmacists. I've always loved that. Something that I never envisioned for myself, and that is being an author. When I was in my 50s, early 50s, just through a conversation with friends, we talked about how much we love to teach students and precept students, which is the official terminology, and came up with an idea to put together a manual for helping other preceptors cover more globally the things that we felt were very important in working with students and pharmacy residents. And I'm happy to say that by December of this year, we will publish our 4th edition.
Wow.
And so that was one of the things that I'm just so happy with, because it is a true love of mine. And among the many things I had planned in my career, being an author and an editor was not one. And it was truly a labor of love and an experience that I am so proud of, very proud of.
So, Lou, you were basically resident here at TIRR for many years. You started, I think, in 1974.
Correct.
And recently retired, I guess.
Just a few months ago.
2018?
Yes.
After how many years?
45 years.
Wow.
45 years. And you know, over the years, I've had opportunities, but there's something about this place, the culture of this place, the love of the camaraderie of all the folks, the nurses and physicians and therapists, working together, and the respect that all the disciplines have for one another, for being highly competent in their area of expertise. That draws you in. And then, of course, the patient population and how appreciative they are. I like to tell a story. When I was a young practitioner, a gentleman who was a para, that I got to know.
Paraplegic, you mean he's spinal cord injured probably, and
spinal cord
had the
injured,
use of his arms, but not
his legs. Correct. And I got to know him and his wife, and part of our mission is teaching as well. And we always would teach the patients and our family about the medications, because they're going to be on them for most of the rest of their lives. And it was so encouraging to me, and so I was so grateful. He was discharged and came back for clinic, and he stopped by the pharmacy and asked for me. He said, "Ms. Cuéllar, you taught me so much about my medications. The doctor has just placed me on this medication. Do you have a few minutes that we can sit down and talk?" And as a pharmacist, that's the ultimate compliment.
Wow.
And so things of that nature. Seeing the camaraderie among patients when I started here, and probably at the same time that you were a patient here, we had wards. There was no such thing as individual patient rooms.
Yeah. When I was a patient, it was 1968, and there weren't any private rooms. Mm-hmm. The patients were all divided up into, at one point, the first station I was at mm-hmm. had 8 beds in the same room, and then I graduated to a room with only one other companion, but we never for years and years had private rooms, and now I guess all the patients are in private rooms or semi-private rooms.
Correct.
Much like other hospitals.
You know, I'm curious. I always had the feeling, just for searching for the appropriate term, that despite the ward aspect, or what people think of wards, that for our patients who at that time were primarily young, male, spinal cord injury, that allowed for some camaraderie with
Let me tell you what happens. People don't understand this, and the people who push to have everybody in a private room, if you have a traumatic, serious injury or illness, I really don't think it's healthy to be by yourself in a private room or with somebody who can't relate to you. And on those wards, there were 8 of us, as I said, and we were all young, and we had all experienced a terrible breakdown in our lives. I had a spinal cord injury in a car accident. The guy across from me was a bull rider and had fallen off a bull and broken his neck. The guy next to me had polio 15 years earlier. Another person across the room from me, Scott, had been riding in a Jeep on the ranch, and the Jeep flipped. I mean, we all had our own stories, and we shared those stories, and we talked about, well, that's how life was. That was good, you know, to kind of maintain a hold with the past. And we talked about, well, what do you think life is going to be like? And one of the guys in that ward, Cowboy, he's the one that fell off the bull. He had been injured for some time, and he had been out, as we said, you know, it's like being in a prison and being out and coming back and talking to the newbies about how things were. And, you know, he had a certain perspective. And, you know, we would challenge him. And if one of us got angry, we all kind of supported them. And if one of us got depressed, we all supported them. And the families, even the families, people say, well, the families want their privacy. We had curtains we could pull around the beds and so on, but the families got to know your neighbors too. And you know, my parents and my sister got to know a couple other guys on the ward and stayed friends for a long time. So hard for me to criticize that, and I think there were some therapeutic value to it, and it's, I guess, one of the things we can talk about here in terms of the changes we've seen in the approach to medicine. But one thing you mentioned, Lou, that I think is important is TIRR has always had what you might say is a unique culture. It's one of the only clinical settings that I know where there is a family feeling among the staff that extends to the patients. And part of that, I think, is due to the fact that our patients are here more than 2 or 3 days. So it's not like in a regular hospital or clinic where you know that person by their chart and their name and they're gone next day. The person is with you long enough, 3, 4, 6 weeks, maybe longer, that you see them every day, you get to know them, you learn their personality, you learn something about their families, they share that, and you share that with them, which is atypical. I don't think in most hospitals patients are interested in, care to, or bother to learn anything about those who are caring for them. And your example of the patient who came back and wanted to have a cup of coffee is a good example of that.
Oh, I agree, and I don't want to lose the thought that what you talked about. I think not only the collaboration and cooperation, but particularly from the mental health aspect, to be able to in that environment when you're down or when you're doing really well, to have that encouragement from someone who can. It's just like when someone gets divorced or dies, and you always provide, you're sympathetic, but you can't really say I know how you feel if you haven't experienced that.
Exactly.
But in the ward aspect, and all being of similar age, you have experienced that, and it's something that helps you through the crisis of the trauma that you went through.
No doubt about that, and I think the staff acquires some of that understanding as well. Lou, this has been good conversation. We're going to break just a second. You all please stay tuned to Focus on Abilities. We'll be right back. More of the stimulating conversation about the history of TIRR with Lourdes Cuéllar. You're watching the #1 show on television, HTV, and I'm Lex Frieden, and this is Focus on Abilities. We're here today at TIRR Memorial Hermann with Lourdes Cuéllar. Lou, you were pharmacy director and staff. I mean, you directed all the services for a long time.
I had several services that I oversaw administratively at one time. I never gave up my profession, which was pharmacy, and I actually became director in 1979. But over the years, really had most of the services outside of nursing or therapy that reported to me. So it was really a great opportunity for me professionally to learn as well as and expand my own training and skills. But it really kind of solidified the wonderful culture that we have, getting to work and oversee great leaders in some of the other areas such as imaging or nutrition, housekeeping, maintenance, urology, the outpatient clinic. These were all wonderful experience. Probably if I were to choose one area that was a special joy for me was when I was given the opportunity to take over as administrative leader over the outpatient clinic. I had in my mind a vision of a medical home for our patients with disabilities, where a patient could come not only to see his physiatrist, but if there was a urology issue, we had a urologist on staff.
So a one-stop shop.
A one-stop shop. And the most beautiful part of that is that they were with staff, nursing staff, who were rehab professionals. And so they were used to transferring patients that needed to be transferred, turning the patient, assisting the physicians. But the whole idea is similar to many of the other clinics that exist now as part of healthcare today. It just was a vision that I had, and I was fortunate enough that our Chief Medical Officer, Dr. Gerard Francisco, had the same vision and supported it.
You know, that's one of the changes, however, that has occurred in the approach to medicine, and I think part of it is a function by changing payment mechanisms and
Absolutely.
So forth. You mentioned that the people who work in the clinic at TIRR know how to help people with disabilities, people with impairments, transfer, how to help them do things that they don't do themselves, but they typically at home have a family member or a caregiver who may assist them. But when they go to a clinic, an ordinary clinic, nobody there can help them. And
I've heard many stories.
Yeah, one of the advantages of coming to TIRR for those kind of ordinary clinic services is that they have an extraordinary support staff who can help people transfer. I mean, an obvious example that the audience will understand is that when I go to have an x-ray at an ordinary hospital or clinic, and the table is up here and I'm down here, and they say, okay, get on the table.
Yes, I've heard
I
that
don't
story.
move, and I'm like looking at them like, what do you mean get on the table? How are we going to get on the table? At TIRR, not only do the people know how to help you get on the table, but we have tables that adjust down to the level of the wheelchair. And I'm not aware that there's nobody else in Houston, no other, in Texas that I know of, that have those accommodations. And it just, the idea that the payers then, the insurance companies, would say, well, we can't pay for that at TIRR, you have to go to another clinic, is absurd. And I'm sorry, it just doesn't work for people who have extraordinary circumstances,
yes.
and challenges. So the idea of having a one-stop shop or a medical home, and did you coin that phrase? Because you know, we started doing that before it became a popular phrase.
I didn't coin that phrase. Obviously, I had read on it because there's been a lot of research in that area. But when I presented it, we were having a strategic planning meeting at the executive level. And I actually, with the help of our marketing manager here at TIRR, we actually drew a home. And we had the different rooms and what the services could be. Because in my mind, for example, a perfect example of how we can really assist everyone from the young ages to the elderly in this area was, I always tell the story when we had a muscular dystrophy clinic here. And come time to have the flu shot, we got everybody pre-approved through their insurance, and they would literally drive through. And our nurses, they'd lower the window, verify.
That's right. When you say drive-through, you don't mean drive the wheelchair through.
No, I
mean,
mean
in their car,
they would receive.
They roll the window down, and you
absolutely.
inject
And the whole
them.
idea was they were able to get what they needed. They didn't need to transfer out. You know, parents were happy, child was happy. It was very efficient.
Have you ever heard about? I mean, has that been done elsewhere? Is that a typical?
Not that I'm aware of. We did that for several years.
I think a lot of things happened here that have never been replicated and aren't done anywhere else, just because people got creative about
Yes.
how can we help this particular population be as healthy as possible. And you know, that simply doesn't happen in what we call the standard care system. It only happens in what we might call specialty care, but I don't think the people who work here think of it as specialty. They think of it as people who have certain needs, and we need to figure out how to meet those needs best.
I agree, and you know, thinking the one area that I wish I could have fulfilled and was not able to fulfill, and it's still a dream of mine, and that has to do with well woman services for our patients. We have many women with disabilities who have not had a well woman exam because the average physician office cannot accommodate them. Again, it goes to you go to a physician's office today, you see usually a medical assistant, they come in and take their information, then the doctor comes in, and having to be transferred, having to be assisted, even being able to roll into the room in many of the physician's offices are not accessible.
Well, I mean, you can't get a breast imaging anywhere. I mean,
and having a mammography exam where the machine actually comes down to the wheelchair level,
right,
to me would be absolutely perfect. So that's one area that I think that there's still hope for improvement for many of our patients. But again, that was such a joy because we got to build it. We started out with 13 physicians and at one point had 33 that were providing specialty services for our patients.
Well, and it's the whole range of services that everybody needs, but adapted for people with disabilities. That I think really was kind of a breakthrough movement. But at some point in the past, TIRR actually was a full service hospital. I mean, with we had our own ambulance, we had our own emergency room.
We had our own OR, which was absolutely wonderful because when patients had issues such as they needed plastic surgery due to perhaps a bad having a bad decubitus that needed care, not only were the surgeons very good at the work, because the surgeons that work with us were dedicated to our patients.
Well, they were attracted. They were willing to go outside their normal space to come here and do things for people that nobody else could or would do.
And some of these people were absolutely wonderful. I had the privilege, and it was a privilege, of knowing Dr. Paul Harrington, and his proteges.
Oh, no, we have to stop there. Now you started naming names, and there's a whole list
Yes.
of names that I want to go over with you, Lou. Dr. Harrington is probably the second one on the list. I want to start with Bill Spencer, who founded the hospital. But right now, I think it's a good time to take a break. Let people catch their breath, and we'll be right back. We're going to be back with more on Focus on Ability. Stay tuned. Thank you for watching our show today. This is Focus on Abilities. We're here with Lourdes Cuéllar, and Lou, or Lourdes, you were at TIRR for 45 years.
45 years.
And during that time, you met a lot of remarkable people, both patients and service providers, doctors, nurses, and scientists.
And celebrities.
Engineers, orthotics people, celebrities. Let's see if we can remember a few of them. John Travolta.
I remember him distinctly. I got to shake his hand.
Was he dancing when he came in the front door?
No, he was wearing, I distinctly remember he was wearing a brown cowboy hat, jeans, and a plaid shirt. He was a young John Travolta. They had just finished The Urban Cowboy. And actually one of his co-actors was a patient, and he would fly down to visit him. He was lovely. He was just very nice to the staff, and, you know, shook everybody's hand.
Who else besides John Travolta do you remember?
I remember meeting the King and Queen of Spain when they visited. They were delighted because I could greet them in Spanish, so they really smiled. Lovely couple. Fergie. Fergie.
Right. She sat down and read stories to some of the kids.
Yes. I remember her. I had my picture taken with the Fonz, Henry Winkler, when he was here.
What was the Fonz doing here?
His mother had a stroke, and he talked about, he had learned quite a bit about it, and he had learned about dealing with spasticity, and was actually here talking about the care his mother had been given and the improvements she had had.
Others you can think of?
A lot of sports celebrities.
Jacuzzi, the man who invented the jacuzzi was a patient here.
Oh, I didn't know
Sure
that.
was. He was right down there on the third ward. He was a patient here for a while, and we had several sheikhs. But one of His Majesty's brothers was a patient and did not like the size of the rooms in the hospital, so they went to the old Hilton Hotel that was over Shamrock Hilton, and rented a whole floor in the hotel, and Dr. Spencer transported our staff back and forth to the hotel to care for him. And I believe that was a good one too, because they paid in cash when they left. Lou, others that you can think of, other celebrities?
I don't know all their names, but I know, particularly in the era of the Houston Oilers, when there were kids here from high school or college who had been injured on field, it was not unusual to see one of the Oilers here. And I even remember one time Bum Phillips stopping by.
And the famous Buffalo Bill, who was rehabilitated here, came in on a stretcher and left walking. Plays basketball today.
That was amazing to see. Amazing.
And Gabby Giffords, of course, you can't forget her. A lot of nice people, wonderful people, and the people who've worked here. Bill Spencer, the founder, Paul Harrington, who invented the rods that help people straighten their backs. We had the first phrenic implant here at TIRR, an implant that actually, this was a long time ago before we even thought about doing that, helped people whose neck was broken so high they couldn't breathe, helped them make their lungs move.
And I don't want to forget our current governor, Greg Abbott.
Well, now you're back to celebrities again.
But he certainly did his rehabilitation here, and obviously became a Supreme Court justice here in the state of Texas, and is now our governor.
Right.
On there. So we've had some very notable people come through. But I also don't want to lose track that we've had some incredible, I call heroes, like yourself, who've moved on regardless of challenges. Wow. And if you don't mind, I just want to briefly tell the story of Kathleen De Silva.
Oh, we'll come back. We'll talk about Kathleen on another program. She actually has been a guest on our program. Maybe we can get some old clips from
I think
her.
that would be wonderful.
So, Lou, thank you so much for spending this time with us today on Focus on Abilities.
It was my pleasure.
It was kind of made me feel good to think about the history of this place. Founded in 1959.
Yes, and still going strong.
I want to thank all of you for watching Focus on Abilities today. I'm Lex Frieden. This has been a memorable show for me, talking about the history of TIRR and some of the changes that have occurred in not only in our community in this hospital, but in the practice of medicine. And we've talked about people with disabilities, people with the most severe impairments, people with traumatic injuries, and those with very severe illnesses who are actually coming here for rehabilitation and leave here with a different life experience than they had before they started. Many of them successful in their careers going forward, and many of them don't even skip a beat. Talk about the governor. And I want to thank you all for watching today, but we're going to have a follow-up to this program that Focus on Abilities will produce. It'll be available online, and we stream these programs to you over the internet. So check out HTV. Check out the website and look for Focus on Abilities. Thank you all for joining us today. We'll be back with more Focus on Abilities next time, and have a great, great day.